health. It is Breast Cancer Month, all of October. Focus is on that. And that is what we want to talk about this morning with my guest, who is Professor Ronald Wasike. He's a consultant breast surgeon at the Aga Khan University Hospital, and will pay special focus on breast cancer in men. Many have imagined that perhaps is not possible, as women otherwise known to have breasts, but it is an occurrence that takes place, so we'll talk about that. I want you to be part of the discussion. If you have any question for the doctor this morning, any clarification you'd want to seek, you can be part of the discussion. Our phone numbers on your screen in just a few moments, and you can get in touch with us live on KTN. Thank you very much, Professor, for joining us this morning. Breast cancer, and having this 1 month every year that there is focus on it. Why is it that there was need to have that? Is it because of how a complicated disease it is, that there needs to be focus not only in getting people directed to it, but also research?
Yeah, so when we're discussing cancer in general, it's been becoming a problem with time. For example, in Africa, we mainly had infectious diseases, malaria, tuberculosis, and malnutrition.
Right.
But as times changed and the economies improved, it became more and more important that things that come with change in lifestyle, like hypertension, diabetes, and cancer, what we call non-communicable diseases, have become more and more important. But breast cancer specifically is the commonest cancer in the world that affects women, not only in Kenya. And because of it being very, very common, and because of the previous dismal outcomes in terms of when patients got breast cancer and how they died, many more survivors as they came up, they strongly formed groups, advocacy groups, and also the doctors who are dealing, the oncologists who are dealing with this problem, realized that we needed to concentrate more in terms of public education, to bring public health awareness, in terms of screening, to pick up the disease early, and also to make sure that when it's picked up early, what are the modes of treatment that we give these people to give them overall good survival. And because of it being a very common disease, therefore, specific months of October was isolated to educate, mainly to provide advocacy, public health awareness, and therefore be able to pick up, to sensitize people, to make them to go for early screening. And why early screening? Because that's the early detection of the disease is the only hope in terms of getting people to stay after treatment. In other words, aiming at cure. And also, with the current treatment modes, try to save the breast, because breast means a lot to the woman. So early detection leads to almost cure treatment, and also saves the breast of the woman. And that has good overall outcome. So
breast cancer being a scourge in the world, you have mentioned something about lifestyle changes. Is that primarily why we're seeing more cases now than in many years back?
If we speak specifically about our country and the region and Africa, I think the answer is yes. But if you are speaking about in general terms, lifestyle is just one of the components that we think that could be contributing to this rise in breast cancer. But environmental factors, genetic factors, or familial factors are also contributing factors.
All right. So what causes breast cancer?
To be honest with you, it's difficult to actually pinpoint a specific cause of why breast cells become abnormal and grow into cancer. So we actually don't know the cause, like many other cancers, but we can only associate it with the specific risk factors, which I've mentioned in passing, like genetic factors. 5 to 10% of the breast cancer you see, both in men and women, will be genetic. In other words, on the DNA that forms the genetic code, there are changes in some genes that specifically when that happens, instead of doing the work of preventing cancer, when they change and become mutated, then they lead to cancer. That's 5 to 10%. So we are left with 90 to 95% of the rest of those who get because of other issues. And those other issues are familial, environmental, or other changes that might happen.
All right. There's a lot of attention and focus that is on breast cancer in women.
Yes.
And we'll talk about that shortly. But let's begin with breast cancer in men, because many people think it unimaginable that men would have breast cancer. But it has happened.
Yeah, men have breasts, but we all have breasts, men and women. The difference is that in men, the breasts are very rudimentary. They are not developed to produce milk. So in other words, there is breast tissue, and this breast tissue does not develop to really breast that will warrant attention in terms of what controls their growth, because the hormones that control the growth of breasts for lactation are mainly female. It doesn't mean that we don't have female hormone. We have some estrogen that we produce from our adrenal glands and from fat. So those men, therefore, who have that predilection to get enlarged breasts, like women, which you call gynecomastia, they are likely to develop breast cancer. But again, the others may not even have that. Like most of the ones I've seen, about 5 in 5 years, they might have other changes that might be environmental or genetic. So also, the BRCA genes, the breast cancer genes, which have been associated with breast cancer in women, is the same ones that would also give you breast cancer in men.
So the risk factors are the same?
They are the same profile, but the thing is, you must have a predilection to grow your breast. Something.
What is that? Break it down for us.
Yes, slowly. What I mean to say, there are situations where men develop bigger breasts. Okay. For example, if you're obese, you might develop gynecomastia. The bigger breast is called gynecomastia.
Right.
If you take particular medications, for example, for hypertension, there are some specific medications for hypertension or for high acid production, for example, for ulcers, that can make you grow bigger breasts like a woman. Or if you are created, instead of being an XY as a man, you are an XXY, what you call the Klinefelter syndrome, then you are likely to have a chance of behaving like a woman. So you'll have bigger breasts, and these bigger breasts predilect you to having breast cancer. But other factors like radiation, like lifestyle and environment remain almost the same as it happens in the women. So
then would it be correct to say that men who are predisposed to breast cancer are only the ones who would have their breasts enlarging?
Yes. The process of getting your breast getting bigger predilects you to developing breast cancer.
So if the breasts are normal for a man, they should not worry, they need no screening at all?
No, as I've said, that's just one component.
Okay.
The other component will still be environmental, would still be genetic, would still be familial.
All right.
And will still be the unexplained. The bigger majority are unexplained. Maybe the environment end up playing with the genes that change in their function, that they stop the protection of the breast tissue from developing breast cancer.
All right, we have Otieno calling us from KU. Let's talk to him before we get into, you've mentioned, I think, coming across 5 cases or so. So maybe you can talk to us more about, in terms of the numbers, then definitely it appears there are lesser men suffering from breast cancer. Otieno, good morning.
Oh yes, good morning.
Thank you for calling. Go ahead with your question or comment.
Yeah, my question is, what percentage of women in Kenya have breast cancer?
What percentage?
Women in Kenya have breast cancer.
Okay. Thank you, Otieno. So he's asking about what percentage of women in Kenya have breast cancer. Would you have those figures?
We do not have very nice, what we call population-based data, but KEMRI has been, and the oncology research, Nairobi Oncology Research Center, they've been doing some work. So in 2002, they came up with figures, and these figures showed that of all the cancers that we have, particularly in women, the highest cancer previously was CS cervix, but because of prevention after teachings and promotion of safer sexual habits, we know that CS cervix is mainly sexually transmitted by human papilloma virus. So that promotion of prevention of STDs, prevention of HIV, had actually reduced our numbers of CS cervix, and that has been overtaken. So when you look at women, the percentage in women is about 23% of all the cancers that affect women is breast cancer, and that's at the top, followed closely by cervix at 20%, and then the others come in.
Okay, back to the men and the breast cancer in them. So there are fewer cases of that.
Yeah, so like in the last 5 years, I've treated over 1,200 women with breast cancer. I treat like about 20 to 30 patients of breast cancer every month. And in the last 5 years, I've treated only 5 men with breast cancer.
Talk to us about these men and what it is that, do they come and what is it they talk about in terms of the symptoms that are being exhibited, the concerns they're having?
So whereas in women, the commonest presentation, and also in men, is a lump, a painless lump mainly, behind the nipple areolar complex or in the breast. The men that I mostly see, 3 of them that I saw presented with bloody nipple discharge. But still, in women, when you have one side, what we call unilateral bloody nipple discharge, then you have to be worried until the doctor confirms.
So that's a discharge of blood from the nipple?
Yes. So these 3 had bloody nipple discharge. The 2 others had actually lumps, painless lumps behind their nipples.
Okay.
So they presented basically the way women would present. But again, most women will present with a lump other than bloody nipple discharge. So
there usually is a lot of focus in screening ahead of time in those checks. Is it the same for men as is in terms of emphasis to do the same for women?
Yes, so for men, screening will be much easier in terms of self-breast awareness because the breasts in men are small.
Yeah.
So it's easier to feel if something new develops. For example, if there's a lump that develops in your breast, it's much faster for you to pick it up. But in women, when you have bigger breasts, there might be a small lump that you'll never pick. And again, what we are saying in terms of screening, we don't want to feel that lump. We want the disease to be picked before the patient can feel it and the doctor can feel it. In other words, when you go for screening process, like for example in screening mammography, we would like to pick the disease when it is still in the ducts, when it is not a lump, when it's just some change, architectural change, or just calcium deposits.
So then you're saying this self-checking that is encouraged by doctors for individuals, then it's too late, because by the time then you're feeling the breast to check for yourself and you're feeling that, then and the other tests, I guess one cannot do that at home. Before you answer that, though, let's speak to James, who's online from Nandi. James, good morning.
Good morning.
Thanks for calling.
Mimi naitwa James Maisha Pandala. Swali langu ilikuwa ni hii. Dalili za kansa huwa inaonekana ikiwa ni dalili ya aina gani? Halo?
Halo? Tunakusikia?
Nilikuwa nauliza kwamba dalili ya kansa huwa ni nini hasa?
Kwa nini kansa ni mingi?
Kuna kama hiyo umeongea siku ya leo.
Okay.
Asante sana. Huyu James Maisha.
All right, James, thank you very much. Ask about this dalili. Dalili is
symptoms and signs.
Yes, symptoms and signs. So maybe you can answer that and then we'll go back to my question.
Yeah, so symptoms and signs. Usually, as I've said, the commonest presentation or the symptom is asking, and I don't know whether they will understand because he asked in Kiswahili. I'm not translating medical terminology. Kiswahili is
we'll
quite
try and simplify it in simple English.
So there will be a mass or a lump
in
the breast, and usually this lump in the breast, whether it's in a woman or a man, is painless. So that's the commonest presentation.
Yeah.
And that's why most patients don't go to the hospital, because anything that doesn't cause pain
or discomfort,
then you do not say, you can pray about it or you can postpone and hope that it will disappear. Maybe it's related to the period or something. So that's one strategy about it, because it's painless. The second commonest way is, as I mentioned, change in the size of the breast or shape, not related to your growth or reduction in weight. That change that sometimes might have a skin change, like skin has puckered up, or skin has become red suddenly and maybe you're not breastfeeding, or it has dimpled in to appear like an orange cover. That is, although that's a late sign of breast cancer. The other commonness is nipple discharge. particularly nipple discharge that comes out when you don't express, it comes out by itself. You're lying on bed, you're walking or you're running, and then discharge is coming out, particularly if it's coming out on one side, one single side, and if it's bloody or dark in color. That has to be ruled out as a sign of breast cancer. Some patients will present with late symptoms because the breast is related to the armpit, or what we call the axilla. So the lymph nodes there can sense it because they are they produce defense cells. They can sense that there's something wrong happening in the breast, and they will grow bigger. So they might present with a mass in the armpit or in the axilla. Or they can present with late symptoms when the cancer has left the breast and involved the bone, the lungs, or the liver. So they present with signs that affect those structures or organs like bone pain, coughing blood, difficulty in breathing, and yellow eyes.
So from what I'm hearing, then self-examination and you start feeling those lumps, then that is late in the day in terms of catching breast cancer.
Absolutely.
So then are you saying medical examinations is what one must do, and if so, how often?
Yeah, I think that there are two components to it. For a long time, particularly in the last 2 decades, we emphasized a lot about breast self-examination. And there were a lot, of course, up to now, 50% of the patients I see come when they have picked the disease, which is late in quotes, because when it's confined to the breast, we're still thinking it's early. But our take is that we want to pick it even before it becomes that lump, when it is stage 0, because we'll be talking about stages. And for that to happen, you must go for screening. And screening means you're going to go through breast examination by the doctor, will find nothing most likely, but send you for a mammogram if you're 40 years and above, or an ultrasound. If you're high risk and you're below 40, we might utilize the magnetic resonance imaging, which helps us to pick the disease much earlier and therefore deal with it in 2 ways. Here we're aiming at cure, and we're aiming at conserving your breast and therefore preserving your image and giving a long life.
Okay.
Yes.
So our time is up, and I think we'll need to definitely have another discussion. Being Breast Cancer Month next Tuesday on Our Health, we will focus more on this to get into the stages you mentioned and management of breast cancer. But finally, what is it you tell people at home in as far as just those checks? Is it eating right as well? What is it do they need to ensure to stay away or ensure they do not get breast cancer?
So there's a lot of epidemiological data that shows that a good lifestyle, for example, eating a lot of vegetables, eating a lot of fruits in a day, which has what we call antioxidants, vitamin C and E, helps you build up a good immunity that provides natural killer cells and boosts the chances of you not developing cancer, not only breast cancer, prostate, colon, and the rest. But in addition to that diet, giving you a good protection against cancer, it protects against cardiovascular disease, obesity, and diabetes. So in terms of food, that is important. Exercise is also good, because exercise helps you to boost your immunity, but also maintain or reduce your weight. And that has that good effect. But the other component that people don't know about is social networking. You know, we are naturally social, so we need to have networks, either at home, at work, and also in church. That boosts your immunity also. That's why people who pray have a tendency to heal better when they are sick, and also have better outcome and outlook in life.
Okay. Yeah. Thank you very much, Professor Ronald Wasike, for joining us. Definitely a conversation that must continue, and hope to have you again, consultant breast surgeon at Aga Khan University Hospital. Thank you very much, as we mark Breast Cancer Month, even here on Morning Express. And we thank you for staying with us throughout the show. Enjoy the rest of your day. We'll see you tomorrow.